Medical teams in western Yemen are struggling to treat dozens of people injured after recent U.S. airstrikes on Ras Isa port. More than 240 people have been killed by American strikes in Yemen since March 15th. And local hospitals are facing a shortage of resources and lack of international support. Our correspondent Ehab finds out the latest.
In hospitals across Hodeidah, 170 people are being treated after being wounded in the U.S. airstrikes in Ras Isa port. They are receiving care under difficult medical conditions. Among them is Hamid Aidani, a port worker who was immobilized by shrapnel injuries.
When we arrived at the Ras Isa port dock and were getting out of the car, the airstrike started. There were 8 double strikes. That means 16 explosions. I was hit by shrapnel. Thank God I survived. I tied my leg. I saw it was almost cut off, but still hanging. I tried to crawl to a safer place while the fire kept chasing us.
Medical services have sharply declined, and most health facilities are no longer working. The health sector in Hodeidah is among the most affected. The crisis has worsened after UN agencies cut their support and the U.S. stopped funding organizations that back the health sector. Still, health officials say they are doing their best to handle the pressure caused by the latest airstrikes with support from both public and private sectors.
There are difficulties, complications and real pain for the wounded, but the health sector, with the help of all hospitals, their staff and strong public support, will be able to handle any cases. The government and the private sector are working together to face the situation.
The health crisis in Yemen is one of the country's biggest humanitarian disasters. More than 17.8 million people urgently need medical help. Women and children are especially affected. Malnutrition rates are high in many areas, including Hodeidah. Despite the harsh conditions and limited resources, doctors in Hodeidah continue to perform their duty. They provide care with what is available, facing daily challenges to save lives in struggling healthcare system. Ehab, CGTN in Hodeidah, Western Yemen.